We are talking tailbone pain and products that you need in your office for your patients. And these are the main products that we use for tailbone pain in our office. So when we are discussing the exercise ball when it comes to tailbone pain, instruct your patients to, especially if they're pregnant, make sure that they can get down to the floor on both knees and then getting up off the floor with both knees. We want to limit the amount of times that we have to go into that deep split stance. And then, so when you get them down, they can take their exercise ball and they can lengthen through and instruct them to get really, really, really deep with this stretch here. This will open up this entire area alongside into the piriformis muscle all the way into that tailbone to relieve tension that they might be feeling. Make sure that they do both sides with this thing, because even though it might only be causing them pain on one side versus the other, we still want to do both to make sure that we're targeting both piriformis muscles. When they're getting off the floor, one more time, tuck their toes under and then get up super slowly. Another product that you need in your office is either, we're going to go over the Boppy first. So I'm going to set these ones to the side here. But Boppy can be used for many different things. And so instruct your patients to have one of these at home, have them have a donut at home if they're having that tailbone pain. In office here, we like to use it this way to have them sit on it just to have relief off that tailbone, have that hole right where that tailbone would sit so that they don't put compression on it or sit on it solely. So have one of these in your office. Have like 5 Boppies in your office, because you always need them for nursing mamas. You need it for children. You need it for pediatric care. You need it for basically everything. So make sure that you have like 5 in your office. And then we are going to go over the sacrotuberous ligament using the tennis ball. So make sure that you instruct your patients where to find this. Most patients think that the piriformis is the same thing as the sacrotuberous. It's not. So on myself here, piriformis is right in the center. Sacrotuberous ligament is right up in here. And so what I like to tell patients is go to the sit bone, go a little bit towards the inside, and then push straight up. You can also show them how to do this when you're doing the Webster technique. Poke where you feel that sacrotuberous ligament like you would with your Webster technique, and instruct them where to find it. So using the tennis ball, I'm going to sit on that sacrotuberous ligament and make sure it's a hard chair for them. Not too squishy. Couch is going to be way too squishy, but just either do it on like a dining room chair or something like that. Have them sit on it. I like to tell them to sit for about a minute. And then what you're going to do, if they want more intensity, tell your patients to raise their leg up, move it out to the side, come back, and then relax. So the relaxation component with this is super important, just to kind of relieve that pressure off that sacrotuberous ligament so it's not a continual force on it. And so make sure you are switching sides with this. Yes, with Webster technique, you're solely only going to be on one side of the sacrotuberous ligament, but with this technique that patients are doing at home, they may or may not know what side is tight. So I always like to tell them to do both just in case, and just instruct them that one side might be tighter than the other. Another product that you need to have in your office is this sacroiliac belt. This is not a belly band. So what this was doing is it provides that compression around the pelvic girdle and squeezes in to relieve that tension and that tailbone pain. Sometimes with your patients, they might explain tailbone pain as the same thing as SI pain, but we know that they're different. But from a patient standpoint, they will get relief from this SI belt no matter what. So when you're instructing your patient how to put it on, make sure that it's nice and low. I'm going to check in the mirror here to make sure it's right in the right spot. Make sure it's nice and low. I would help them put it on in clinic so that they know how tight to do it. So even with this one, I need a little bit of help to get it tighter. So I'm going to kind of crank it that way. So instructing your patients to put their husbands to work or put the partners to work with this, helping them out at home. And then take these nice little bands here, stretch it out over top, and it provides a really great compression into your pelvic girdle and to provide that tailbone relief, because most of the time tailbone pain, they're gonna say it hurts right about here, which is right at the level of the SI joints. Yes, sometimes it's that coccyx, so that sacrotuberous ligament, the tennis ball stretch, is gonna be really beautiful for your patients, but this can provide that relief when they're walking around at home, going for walks with their other kiddos, with their dogs, anything like that. Even if they're doing house chores, this can be a really beautiful way to help with security and make sure that everything's holding nice and tight for them. If you have comments, questions, concerns, leave them in the comments below, but of course subscribe to our YouTube channel for more product related videos.